My name is Heun. I'm a consultant psychiatrist. I work for Global Psychiatry Archives, and today I want to talk about something which is a bit neglected, and you will learn to deal with this at the end of this video. It's Munchausen syndrome or factitious disorder. Munchausen is a person who had been described in fairy tales, who was lying horrendously and was leading a very fantastic life, flying on cannonballs and other things. He was talking to other people. Anyway, the name is taken from this person, Munchausen syndrome, or also factitious disorder, where patients intentionally falsify their symptoms, their past history, and sometimes fabricate signs of physical or mental disorder. Just the intention is to get medical attention or treatment, and it's classified as a personality disorder. There are different features. More or less all types of diseases, somatic, physical, or mental disorders can be more or less played or falsified or exaggerated. I remember a patient who was in neurology department, and he feigned and produced epileptic fits, and eventually he then really had an epileptic fit, and possibly he tried to falsify that he is believed, and he more or less tried to prove that he has something which is very severe. And because nobody believed him, he was producing it. So sometimes it can have very weird intentions. Many people who falsify diagnosis, such as suicidality and mental health, they are very often men who wander around from hospital to hospital, go from place to place, are admitted to hospital, and have the advantage of staying into hospital. So we recently had a patient who came from London, then went to Cumbernauld, and then eventually to Glasgow. And the advantage was that he would be in hospital, be with other people, not isolated, and eventually get some housing benefits. Right, there are other people who are non-wandering, very often women, who have more stable lifestyles and sometimes less dramatic presentations. Very often the physical symptoms, somatization disorder, or borderline personality disorder, emotional instability. There's something which you see very rarely, which is Munchausen by proxy, when mothers or carers of people produce or simulate physical or mental health problems in their dependents. So this can lead to lots of harm if the child is whatever has to show physical signs, and the carer then produces these signs. So that can be quite dangerous. So the intention then is to prevent that. So as I said, the behavior can more or less mimic any psychological or psychiatric illness. So there can be infections, simulated illness, interference with other lesions, self-medication, altering records, and reporting false or physical or psychiatric symptoms. As I said before, producing the symptoms of depression and suicidality is very easy, because there's nothing you can really show, and the only way how you can find out is about if people change their story, or they're observed in a different state, then they report that. So usually there can be somatization disorders, so there's no conscious production as a differential diagnosis. So let's say that way, sometimes in somatization disorder or functional disorders, there is not this conscious production. People do things, but there is not the wish of a benefit. So, and this is called malingering, when people have a secondary financial or other gain. The gain can be avoid the army or anything. Very often people have substance misuse, and they can then hope that they get prescribed drugs when they tell that they have pain. Other people have depression, psychotic features, and sometimes it's very difficult to distinguish. The cause, unless it's clear malingering, is usually unknown. There might be some childhood neglect as a risk factors, and it's very common in people who have some medical background, paramedics or nurses or care assistants are sometimes more prone to this than people who work in a completely non-medical field. So what do you do? There's not much you can do. There isn't any real treatment. People are reluctant to consider treatment. Sometimes they come up with stories about excessive side effects from medication just to prevent people, let's say, for example, to treat depression. Sometimes, people can be directly challenged, which is very difficult, because what happens very often that people are very unhappy. They can be very aggressive, and in a way they just leave them the hospital and go to the next one. Sometimes these indirect challenges can be quite helpful. So instead of challenging, you can find a way out and say, okay, if you take a medication, let's say someone presents as depressed and has no depression, then you can say, okay, you either give some placebo or a low dose of an antidepressant to give them the chance that they have some treatment, and then I can say, okay, things get better. The other thing is then what is important, that we don't have any iatrogenic harm. So in a way that, too many assessments or invasive assessments might cause more harm. Let's say if someone has to have a knee assessment with incisions and maybe having an arthroscopy, so that might be something which causes more harm than the benefit. So in this respect, it's sometimes very important to present, or to be very careful not to do too much. Right. On the other hand, I must admit, I had a patient who was running around as a Munchausen patient for years ago, and he had back pain, he was gay, and he was more or less walking on crutches, and so people felt, this guy must be gay, and maybe, I don't know, they said, there must be something, that he had inappropriate sex and was stuck in this mentally. Interestingly, this was a time when CTs were developed, and this guy had a tumor around the spine, which caused him severe pain, and he behaved in a way that people would think he had a Munchausen syndrome. So it's very important to have a look very carefully, not to make conclusions immediately, because sometimes people fake disorders just to get the attention they need for physical health problems they have, and which haven't been cared appropriately in their feeding. Right, but there is Munchausen syndrome. It's rare. It needs to be detected, and I think we have the responsibility to deal with that appropriately. But it's not easy, and you can consider your approach and make a proposal. Happy to hear about that. If you're interested in more mental health stuff, please consider subscribing to our channel, Global Psychiatry Archives. Thank you.